All right, so now that you've finished with your wire bending, depending on the scenario and depending how many abutment teeth you're going to be using for the wires, now we're ready to set up the teeth. Okay. Obviously I have my incisal pin on this case, but because I do have a tooth-to-tooth contact here, I could remove the incisal pin to give me a better view angle, but you have to be careful not to damage any of the teeth when you take off your pin. So you got to work with it a little more carefully. Okay. Make sure that everything is in good centric contact. There's no interference of the wires between the wire itself and opposing dentition. So everything has a good clearance. When selecting the teeth, we pre-selected the teeth for this case, and these might be a little bit on the big side. So to find the perfect match for the natural tooth here, and this is the big area of concern, aesthetic zone here, is like a needle in a haystack. So in all probability, you're gonna have to find a bigger mold and shape it the size and make it match the adjacent natural dentition. Okay, so we'll start off with tooth number 11. We'll finish with the interior arrangement, and then we'll finish with the lower posteriors. Now, what you'll need for this particular exercise, obviously the teeth that you pre-selected. You'll need a handpiece with a small burr, perhaps maybe an even smaller burr, a number 8 round, to do some final occlusal adjustments. Maybe a smaller tapered burr to grind the inside of the teeth when you're getting closer to the guide planes. And we'll see how far we get. And also, obviously, we'll need some articulating paper. Okay. So I'm going to take off tooth number 11 from the card. Wipe off any excess sticky wax that might be on there. Looks like it's pretty clean. And I'm going to tentatively place the tooth where I want it to go. Looking at it from the incisal view, it looks pretty good. That's where I want to ideally place the tooth. But then when I look at it from the frontal view, the tooth is way too long. So the neck of the tooth, or the underside of the tooth, the ridge lap side of the tooth, is prematurely hitting the model surface right there. So I need to trim the inside of the tooth to get this tooth to go down to that level, but right up against the mesial contact. Okay, be very careful. If you're not sure, do this in increments so you don't ruin the tooth. Otherwise, you'll have to order another set of teeth. So I'm going to take a small tapered burr and grind the underside of the tooth, mostly on the mesial aspect. I'm going to anchor my hand to my other one and slowly trim away the underside of the tooth, but be careful not to get too close to the cervical margin of the tooth, right? Some teeth are a little more noticeable than others. Try to preserve that cervical margin, because ideally that's where you want to wax it up. So I've trimmed mostly the mesial third, facial mesial third of the tooth. So I did a little bit. Let's see how this fits back on there. It's getting closer, but it's nowhere near being close or accurate. Still a lot. So I got about 2 millimeters that I need to move this tooth a little more towards the apical. So I'm going to keep going some more. So hold the tooth firmly. Just increase the RPMs a little bit to about 20 or so. So do this in increments because you're not sure if you're grinding too much. Don't overdo it. I still need to do some more. Right underneath here. Right at this point. Right there. On the mesial third of the tooth. So I'll hold it at a different angle now so I can see how much I'm grinding. Now with the tip of the burr, which allows me to get in there into a tighter space. And if I had to, I would use even a smaller burr to get more of a finer finish versus that one. So play around with different burrs. Obviously, the bigger the burr, the faster you'll trim, but be careful not to over trim. So definitely I'm getting closer now. So you see the incisor ledge of the prosthetic tooth is a little closer than it was before, and I'm holding it in an ideal position, trying to mirror the arch form of the 2-1, but I'm not there yet. So I'll go a little bit more. I think technically this is probably one of the hardest things you have to do, which is only second to one more thing, is trying to adjust the tooth to fit around a wire, which we'll do on the lower. Let's see if I'm there. And not also I'm assessing just by viewing the case, I'm also getting a lot of feedback from my fingertips. And I know that I'm hitting it prematurely on the distal facial now. I can feel the model down here interfering. But definitely I'm closer, so I got to trim that a little bit more. Here. And a little bit more on the distal facial right here. And hopefully still preserving that cervical margin that's incorporated into the tooth. So let's see how this looks. That looks okay. In terms of the incisor ledge alignment, looks pretty good. Still looks a little bit on the long side, so I'm going to trim it some more and just visually assess that I need to reduce a little bit more. I'm getting really close now, so you don't want to rush this. And a little bit more here. That's getting a whole lot closer. I'm still having interference on the distal aspect of the tooth, so I'm going to trim a little bit more on the inside back here. All right, let's see how this looks. Make sure your hands are clean of any acrylic dust, because these are very hard to get a hold of. and a little bit more on the distal. I still feel a little interference back here. So I'm going to do a little more reduction back here. I'm getting really close to the cervical margin of the tooth. Now sometimes you might have to go through it. There's no way around it. And sometimes you might have to recreate it with a burr to match the natural tooth, the adjacent natural tooth, especially when you're dealing with interiors, right? Because it's very aesthetically involved. Now, I'm really close now. So what I'm gonna do, I'm gonna place a little bit of wax on the model itself. I'm just gonna round this off a little bit and tentatively set it up into position to see how close I am. So I'm gonna take a little bit of wax, place it right there, not a lot, just before it cools down. Place that tooth into position ideally. So from an occlusal view, that looks pretty good. My incisal ledge looks like it's lining up. I need a little more wax to support it. That looks pretty good. From a frontal view, I'd say that looks pretty good. So the mold that we selected for this case looks like it's pretty much a mirror image of 2-1. Okay. Now I'm going to bring the articulator together to see how much overjet I've created. Nice and slow. Articulators together. Now let's look at it from here. I'm going to take the incisal table off so we can get a better view. That looks pretty good. There's a little more in overjet on the distal incisal third of the tooth than the mesial, but that kind of mimics the other side. So I'm kind of happy with that. Maybe a little bit too much. I think I need to bring the distal incisal a little more towards the lingual. So I'm going to take the tooth off. So I used just enough wax to support the tooth, nothing excessive. So I'm going to take the tooth back off. But in order for me to bring the distal aspect in, I got to trim it on the inside a little bit. So notice the first tooth really sets up the whole tooth arrangement. Especially when you're dealing with interior teeth, you got to go slow and you got to be careful not to overgrind things because you can throw things out of whack real quickly. So I'm going to soften the wax a little bit more and support the tooth once more and see how that looks now. Bring that out. Whoop. Make sure that you don't have any wax between proximal surfaces, so you have a nice clean contact between prosthetic and natural tooth. No gaps whatsoever. That looks okay. That looks okay. And that looks a little closer now. That looks a little more reflective what's happening with 2-1. So I'm happy with that. So before I move on to 1-2, I'm going to take a little bit of wax and seal it. Now, one thing I didn't show you is the facial inclination of this tooth. Is it reflective of 1-1? Let's take a look at it. So if I turn the articulator over and start this way, as I rotate now, and now we have 1-1 in view, is 2-1 the same angle, labial inclination, as 1-1? I think it is. If it's too much, you're gonna have too much of a bulky flange. If it's not enough, it's gonna look like it's collapsed. But it looks pretty good. I had one of my wires that fell off, so I'm just gonna tentatively put it back here, find the little groove that was there before, and just seal it with a little more wax this time around so it doesn't move. Maybe further up here. Okay, so far so good. Now I'm going to take tooth number 1, 2 off the card. Clean off any residue of wax. It looks pretty good. And see how this fits in here. Definitely doesn't fit. It's way too long. So once again, I'm going to have to do some trimming on the ridge lap side of the tooth. Hold it firmly. Anchor both hands together. Now, in the beginning stages, this is going to take you a long time, but over time you get a feel of how much tooth reduction initially you got to do. If you're not sure, put a little bit of wax, place the tooth in position, and check it again. But from experience, it tells me I got to reduce the distal aspect. Make sure you're trimming the right side of the tooth. So I'm going to trim a little more of the distal. And see how that fits back onto the model. I'm getting really close, but definitely the incisal edge of this tooth is much longer than that one. So I got to reduce the underside some more, and a little more now, a little more angled on the mesial and distal to accommodate the shape of the ridge. This way and that way. This way and that way. All right, let's see how that fits. That's starting to look pretty good, at least from this aspect. The tooth almost is in position. So what I'm going to do, once again, is put a little bit of wax and verify that position from all angles. Okay, occlusally, it looks like it's symmetrical with the other side. From a frontal view, it's still too long. So I need to reduce some more. From a labial inclination, that looks okay. So definitely I have interference underneath here that I need to reduce in order to get this tooth to move a little more apically. So I'm going to take it out. And I would say a good millimeter of reduction. I'm trying to keep my reduction uniform as I shaped it already. Getting close to the cervical margin, but I think I can get away with it. Soften up the wax. Just enough wax. Try not to get wax interproximately because you'll create diastemas in between the teeth. And let's see how this tooth now looks from this view. Still looks long, I think, in my opinion. If you're not sure, maybe it's correct, maybe it's too long, maybe it's a little bit short, put on the next one. Put on the next one because it will give you a better idea where you're going with this. You can, sometimes I like to cover the teeth just like that with my finger, just to get a better idea of the length. I think it's just a little bit long still, so I'm gonna take it off and trim it some more. Very minimal reduction now, not a lot. And let's see how this fits. Soften up the wax once again before it cools off. Place it in position and see if that tooth has moved down a little bit. That still looks okay. I can definitely see a change now when I do that. So I think now the 1-2 is a little closer to the 2-2. Okay, happy with that. I'm going to seal the tooth down with some wax. One thing I want to point out, this works well when the models are dry. If the models are wet, you're trying to tag your teeth onto the model on a wet model, it doesn't work very well. So make sure your models are dry before you do any setting up of the teeth, especially for acrylic partials. Now the last one, the 1-3. I'm not sure how this is going to fit in here. Hopefully I've selected the mold that's a little bit too big or just right to fit in there with minimal effort. It looks okay, but definitely this tooth is way too long. You can see it there, way too long. So I got to do some major reduction on the underside of this tooth, probably all the way to the cervical margin to get this tooth to fit. So here we go. So I'm not going to baby this one as much as I did the other ones, because I know just by visually assessing it that it's quite a bit of reduction that I got to do. At first, go slow, I advise for you. Let's see how this fits. It's definitely lower, but still much too high. If I can show you from a different angle, it's still much too high. And this one takes a little finesse because I want to reduce just enough of the tooth to fit inside into the little socket that I created. Not to overgrind it, because otherwise it's going to get filled in with pink acrylic and it'll ruin the aesthetics of the tooth. So when you get real close, slow down a little bit. I'm going to reduce it a little bit on the outside as well. See how that fits. Not an easy thing to do, because you have all these variables around you you got to take in consideration. You got two teeth adjacent to this now that you have to make it fit. And I feel that there's a bit of a premature contact between the 4 and the 3. So I'm going to reduce a little bit on the distal of the 3. But not to change the overall shape of the tooth. A little bit here, ever so slightly. Okay, back to the underside now. I've lost track where I want to trim it, so if you do that, go back and check it. Check it. That looks okay, occlusally, but it doesn't look okay this way. And I have primarily interference on the distal. And I'm looking on the inside, yeah, primarily on the distal. So I'm going to concentrate on reducing the distal aspect of this tooth more than anything right now. Here, a lot. And see where this takes me. So there's a lot of, you're going to go on and off the model multiple times, tens if not hundreds of times depending on the scenario, to make this tooth fit. That looks starting to look pretty good. It's starting to get there, but there's still some work to do back here. I need to reduce now the distal facial aspect of the tooth to get that to go a little bit lower. Let's see if that works. So distal facial, right about here. And I'm gonna round it off a little bit here because I want it to fit inside that little socket that I created. Distal facial again. Let's see how that fits a little bit better. Starting to. But this tooth is just a little bit too wide, so I'm gonna have to narrow this tooth down a bit. Before I do that, I wanna go back to the 1-2. Is it too wide in comparison to the 2-2? No, it looks pretty good. I think I'm happy with the 1-1 and the 1-2. So I'm gonna take a little bit off the distal of the 1-3, possibly off the mesial, but definitely I need to reduce the underside of this tooth quite a bit. Okay, back on we go. Starting to look better. Still too long, but getting closer. And this is where I'm getting primarily most of the interference, back here on the distal facial aspect. So I'm going to reduce some more. Here. And a little bit on the outside, on the facial aspect of the tooth. And once again, to make sure that I don't make it extremely thin to fit inside the little groove that I created on the cast. Okay, getting there, but now I'm getting a bit of a pivoting motion this way, which tells me there's a bit of an interference here, and there's maybe a little bit of interference on the mesial contact area here. So just to make a bit of a happy compromise, what I'm going to do is take my burr, gently, it looks like I'm reducing the tooth, but realistically, what I'm actually doing is removing that little seam that's created in the manufacturing of the molds between the facial and lingual aspect of the tooth. There's a little seam sometimes here with some molds, and if you just round that off, that usually takes care of the problem and things come together a little more closer. A little more on the distal. And let's see how this fits in here now. A little bit better, but I still have interference right here because I want to rotate this tooth now a little more towards the lingual from the distal aspect. But before I do that, let me just close the articulator, see how it looks. Definitely I have too much overjet here now. With the 1-2, I would say, and the 1-3. So I'm going to backtrack a little bit. So now, because I've got all three teeth on there, I have more sense of where I'm going with this. So what I'm going to do is remove this, set it back on my card so I don't lose it. And you see how much different that looks now in comparison to the other one. Totally different tooth. And I'm going to remove the 1-2 as well. And I'm going to backtrack a little bit. And I'm going to take a smaller burr. And I'm going to reduce a little bit of the distal aspect of 1-1. Make sure there's no wax in place. Very, very minimal reduction. Basically, I'm just taking off that little seam that I mentioned before. And I'll do that with the lateral as well on both sides. Low speed and a little bit of a mesial. And that should create a little more width for 1-3 to fit in there. Warm up the wax once more. See how that looks against the opposing dentition. Looks a little long, the tooth. So what I'm going to do, trim a little bit on the underside. Using a much finer burr now. Perhaps it's just my wax that I didn't heat it up enough. Let's see how that looks. That looks better. That looks okay. Labial inclination looks pretty similar. And now I'll go back to the 1-3. And I can sense that there's a little more room for this 1-3 to come lingually. I didn't seal it down, so I'm going to go backtrack a little bit again. Bring it a little more lingually. There we go. So it's a little more reflective of what's happening with 2-2 in terms of the overjet. Seal the tooth down. And that'll happen a lot, right? You're going to have to set up the next tooth to give you more of a sense of where you're going with it. So you're going to have to take the teeth out and put them back on again to make it work. Okay, still a little interference. I want to get this canine a little more towards the lingual, but there isn't enough width in here to allow me to do that. So what do? Do I trim the distal of the 1-2? No, because I like the width of the 1-2. Maybe not. I'm looking at it again. I'm looking at this width span here. I think I can manage by taking off a little bit of the distal aspect. Some more, ever so slightly. Be careful when you do this on the model that you don't damage the model. And let's see if this creates a little more room. I don't think it'll be enough, but most likely I'm going to have to reduce the mesial and distal of the 1-3 for sure. Okay, so here we go. A little bit here and a little bit on the distal aspect of the tooth. Maybe ease up on the RPMs just to give you a little more forgiveness. And then I just want to smooth this out and try it back on. Still okay, but if we try to compare the 2-3 with the 1-3, this looks a little bit considerably wider. So I have a little more room here to trim to make this work, especially on the distal aspect. Hold it in a way that you can view what you're trying to trim. Okay, let's see if this gets a little more towards the lingual. Definitely a little more towards the lingual, but still not there. And that's okay. I'd rather do this in small increments and overdoing it all at once and realizing that I created a space that will require me to order a new set of teeth to make it fit. Let's try that back on there. Now I'm getting close, so what I'm going to do, I'm just going to flow some wax underneath there, so I can tag the tooth into position to see it from all angles. Okay, that looks okay. Closing the articulator, that looks okay too. It looks like the same as the other side. What about this way? This way we have a problem. Obviously the tooth is too long in comparison to the 2-3, and I'm not exactly inside the socket here. There's a little bit of space there. Now, by looking at it, there's interference under the lingual third of the tooth, underneath here. So if I remove that, the tooth should recess a little bit more inside, right in here, right? Inside that margin. So I feel there's an interference here on the middle third as well as on the lingual third. Not so much on the labial. I don't want to cut the labial anymore. Let's see if this helps out. Not so much. Better. Better. But you can see though there's a labial inclination of the 1-3 versus the 2-3. I want to get that tooth to come in that way. And again, there's an interference on the lingual as well as the distal third contact area here. Let's see if this is any improvement. That looks good. That looks okay. That looks much better. How about the inclination now? Still not there. Still, it looks like it's flaring towards the labial more than the 2-3. So I gotta get that tooth to come in more lingually at the incisal aspect, at the incisal third, than what it is right now. And it's interfering with the contact areas, mesial or distal or both. So I'm going to reduce the 1-2. I'm going back to the 1-2 once more. And very carefully, I'm going to reduce the lingual third, not so much the facial third, the lingual third, which I think will allow a little more space for the 1-3. Haven't really changed the shape of the tooth. Let's see if that does the trick. I don't think it will, so I'm going to reduce a little bit more here. And a little more towards the mesial. Lingual third versus middle or facial third. Just to narrow the tooth a little more on the lingual aspect to create that lingual inclination like it is with the tooth 3. So let me just tag that in tentatively. See how that looks. That's still okay. That's still okay. And now needs a little bit more. So what I'm looking at here now is that the buccal slope angle created by the 4 and the 5 is not really matched by the 3, where it is on the other side. So I need to bring that incisal third of the tooth a little more towards the lingual. And it's little details like that that makes a partial, whether you're doing acrylic or cast partials, that really, really make it look like it's real. So in order for me to tip it towards the lingual, I got to remove the lingual ridge lap portion some more. Got to reduce it. See if I can tip this tooth without over grinding the tooth and preserving most of the lingual anatomy. That looks okay. Let me close it. Still looks okay. That's much better. Incisally, looks pretty good. I'm happy with that. I've come real close with trimming the tooth inside the socket, so I'm going to have very minimal pink acrylic on the underside of the tooth. Worst case scenario, if you've over trimmed it a little bit too much and you got too much of processed denture base acrylic showing through, you can go back and fill it in with tooth colored acrylic cold cure on your duplicate model after you process it. But hopefully we won't have to do that, because that's work. More work than we need to have. So I have a nice tight contact now between the 3 and the 4. My incisal edges are lining up. It looks symmetrical. I mimic the arch form on this side as it is on this side. There's no interference with the bite. Overjet looks pretty much the same. Now let's check some excursion movements here to see if we're close. Now, if I start off with the left side, obviously I have canine guidance. So if I move my articulator over here, being natural dentition, I have canine guidance as well as incisal guidance. But look at the 1-1. That's pretty close. Now this is what we call group function, where we have natural teeth and as many as we can prosthetic teeth working in harmony so that one does not interfere before the other. They all work together. So that's nice. I know that patient is not going to dislodge this acrylic partial when they move their jaw to the left. Okay? Let's check the other side. And again, the two canines barely touch each other. At the same time, the posterior teeth are in harmony too. So that's nice too. Incisal, or protrusive movement, I should say. That's nice too. So I got the natural teeth on the left side as well as the prosthetic teeth, or at least the 1-1 touching while the patient is in protrusive movement. Okay, so I'm happy with that. And on the next video, I will show you how to set up the lower posteriors. This becomes a little more challenging because we have a couple of clasps here that we need to overcome to make the teeth fit into the space.